The Canadian Pediatric Society is recommending cholesterol screening for all kids between the ages of 2 and 10. Joining us now with her thoughts is pediatric cholesterol on the study is Dr. Dina Kulik. Thank you so much. Doctor, what are your thoughts? Is this something you would recommend?
Yeah, I think it's a great idea. We haven't before had specific guidelines in Canada from the Canadian Pediatric Society about testing children for their cholesterol, but there are some guidelines out of the US that start at age 9. They recommend to start testing cholesterol in children at that age, but recent studies have shown that we can make a huge impact on these kids' lives if we detect risk of high cholesterol, specifically finding if children have high cholesterol as young people, because that can make a huge impact on their lives, reducing the risk of heart disease and stroke as they get older in life.
And let's talk about the impact not only on their own health, but the healthcare system in general. Why is this important?
If we can identify children that have a family risk factor, and particularly if they have familial hypercholesterolemia at a young age, we can help to intervene by making dietary changes, by making exercise changes, keeping them as healthy as possible, sometimes using medications to keep the cholesterol low, because that can help prevent long-term complications like high blood pressure, heart disease, strokes, and other effects of having high cholesterol.
If there's obviously things that are in, the family's genes, things that are hereditary, we can understand why some levels might be higher. But I'm curious, doctor, what role do parents have in this fight against high cholesterol?
Well, there are certainly children that are at increased risk because of their genetics. And in those cases, we often find family history of heart disease or strokes or other early issues such as high blood pressure. And so those kids should be screened for sure very regularly. But we often find that there may not be a specific family history, or people might have passed early, but we don't know why they passed early. And often it is related to these high cholesterol issues. But intervening early, again, with really healthful diets, minimizing processed foods, minimizing excess sugar in the diet, keeping our bodies active, moving every day for at least an hour, avoiding too much screen time and sedentary behavior. These can all keep kids healthy, those that are at risk and those that are not specifically at genetic risk.
Doctor, the latest numbers from Stats Canada when it comes to childhood obesity and kids who are overweight are absolutely stunning. 2022 to 2024, it shows that approximately 30% of Canadian children aged 5 to 17 are classified as overweight or obesity, 19% overweight, 11% are obese. This is a big problem. How do we tackle this? What is the recommendation for parents, especially for those who struggle when it comes to dinner time and serving healthy foods? And let's just face it, not every kid loves broccoli and other vegetables.
Of course, most don't love broccoli or other vegetables, but I think the biggest thing is to model this healthful behavior, right? So we want to be moving with our children. We want to be going for walks after dinner or going to the park when it's, warm enough to play catch or play tag. Moving our bodies together as a family can be really a huge incentive to get kids moving more, which is important. We want to be mindful of our own snacking as our children as well. If we're, watching screen and being very sedentary and eating snacks throughout the day and the evening, our children will model that as well. So I think a big piece is involving the whole family, getting us all eating healthfully. And there's definitely a role for, foods that we consider, junk foods or sweet treats. There's a role for that in our lives. I don't think we need to go, completely one end or the other. But I think if we can focus on, 80 or 90%, feeding ourselves with healthful, nutritious things, moving our bodies at least 1 hour of heart racing activity a day, keeping screen time below the 1 or 2 hours per day per the Canadian Pediatric Society, that will go a long way to achieving health for all of us, not just our children.
I think there's an unhappy child nearby with the thoughts of eating broccoli soon. Hopefully she's okay. Dr. Dina Kulik, always appreciate your time and perspective. Thanks for joining us.